Okay, so now research has shown that major depressive disorder is not a significant predictor for outcome of BPD. And we talked about that, right? Is that if you treat depression, that doesn't lessen those borderline personality disorder symptoms, criteria, other factors. But borderline personality disorder is a significant predictor of outcome for major depressive disorder. So if you treat the borderline personality disorder, that can lessen, and successfully, and you start to lessen some of those surface structures, surface presentations, issues, that will lessen the depressive symptoms. But lessening the depressive symptoms and saying, well, the personality disorder, we're not going to worry about that, we're just going to treat depression. The BPD stuff still stays there. And you may have had this experience, right? Is that you're on different medications and you're like, well, it's not changing all of this. That's because this is BPD. But it's changing this, which is the depression. Okay, so now these studies, right, so what they found is that they recommended the treatment of borderline personality disorder, okay, with psychotherapy. And what should happen is the priority, so when you have this major depression and you have BPD and they co-occur, so they're comorbid, when they occur together, that the mental health provider, the treatment provider, the psychotherapy shouldn't focus on the depressive symptoms, but focus on the components of BPD, which goes back to dealing with that core content stuff that we talked about, as opposed to just dealing with surface structure. But, and I will say this as an aside, if you have severe, extreme, high, moderate depressive symptoms, these folks tend not to show up for therapy. They're too depressed, they're not motivated, therapy tends to have no forward movement. So that's where medication can help a little bit. You can attenuate some of those depressive symptoms enough to get the client or yourself motivated to come to treatment to deal with the BPD, because if we can control and lessen the BPD, we control and lessen the major depressive disorder. Okay, so now different psychotherapies have been found to be really effective for borderline personality disorder. There's cognitive behavioral therapy, there is DBT, dialectical behavioral therapy, there's interpersonal therapy, and others that are found to be really effective, okay, to deal with BPD, lessen the symptoms of BPD, and get those under control.